everyone. I'm Sarah Bodnar, Director of Community Health at United Neighborhood Centers. UNC has been around for 97 years. We're a nonprofit social service agency meeting the needs of family, youth, senior citizens, and new immigrants in the community. UNC can help with needs such as food, clothing, shelter, literacy, education, budgeting, childcare, and support for your physical, mental, emotional, and social wellness needs. For the last 3 years, in a partnership with the Area Health Education Centers and American Lung Association, UNC has offered smoking cessation groups free to the community. And I'm here with Katie Reilly. She and I are both facilitators of the Freedom from Smoking program, and Katie's going to tell us all about it. Welcome, Katie.
Hi, it's great to be here.
Katie, tell us a little bit about the history of Freedom from Smoking.
Yeah, so the Freedom from Smoking program, like you said, is sponsored through the American Lung Association. Over the past 35 years, this program has been updated and improved several times and is often now called the gold standard in smoking cessation programs. This program is based on the Stages of Change model, which is a tested and respected system to bring about change behavior. As you know, smoking is a complex process involving physical, mental, and social interactions. Freedom from Smoking helps participants learn to manage cravings, thoughts, and social relationships to maximize their success when quitting smoking and to remain a non-smoker in the long run.
Great. Tell us a little bit about the curriculum for Freedom from Smoking and some of the activities that the participants can expect to encounter.
Yeah, so the program consists of 8 sessions which are held over 7 weeks. The first 3 sessions are geared to help participants learn tools that will help them quit. And a few of these activities that participants will complete as they prepare to quit are track packs, they identify their triggers, as well as develop a quit plan. So every individual who smokes has a unique pattern of smoking he or she has developed throughout the years while they've been smoking. The first step in changing the pattern is understanding it. The pack track activity allows participants to record the date, time, situation, activity, need, and mood that is associated with each cigarette. Do they need that cigarette because they're bored? Are they really craving it? Is it in the morning? Is it before they go to bed? Is it a work break? And with understanding why they need that cigarette and understanding the reasons behind it, the participant will be better able to quit. Throughout using the track packs, participants are able to practice the 3 A's for acting against triggers, which are avoid, alter, and alternatives. Throughout the first 3 sessions, participants learn ways to avoid the trigger situation, such as foregoing a work break with people who smoke, or alter or change the trigger situation by drinking tea or juice in the morning instead of their usual coffee. And alternatives are substitutes that can be used in place of cigarettes, such as chewing sugarless gum or sucking on sugarless lollipops in place of that cigarette.
Thank you. What a detailed explanation. As a facilitator, I've always liked that. So all the activities you mentioned, I've always liked that they're all individualized. So even though they're there with a group, there's no assumption that everyone is the same kind of smoker. The participants will usually identify some commonalities across each other. A lot of them are that morning cigarette. They have it while they read the newspaper or have their morning coffee. But the activities are individualized for each individual unique smoker. And I also like that the people aren't asked to quit as soon as they start the group, that the first 3 classes are about preparing to quit. So they get 3 weeks of support before they even have their quit day. And so I know that people might be motivated to attend the group because of some very obvious health benefits. We know that quitting smoking reduces your risk of lung cancer. That's pretty well known. What are some lesser known statistics, Katie, of how your health improves after you quit smoking?
Yeah, so there are a lot of different ways your health improves once you quit smoking. And actually, as soon as individuals quit smoking, their bodies begin a series of healing or recovery changes that continue for years. So just 20 minutes after quitting, the individual's heart rate drops to a normal level. And then 12 hours after quitting, the individual's carbon monoxide level in their blood drops back to normal. Between 2 weeks to 3 months after quitting, individuals' risks of having a heart attack begins to drop and their lung functions begin to improve. And then 1 year after quitting, individuals' risk of coronary heart disease is half that of a smoker. So it's already been reduced to And then between 5 to 15 years after quitting, individuals' risk of having a stroke is reduced to that of a non-smoker. 10 years after quitting, individuals' lung cancer death rate is about half that of a smoker's individual risk of getting cancer of the mouth, throat, esophagus, bladder, kidney, and pancreas decreases. And then 15 years after quitting, individuals' risk of coronary heart disease is the same of that of a non-smoker's. And as well as the health benefits to smoking, there's also some non-health benefits, which is a tremendous sense of control. Prior, really, the cigarettes were controlling these individuals' life, what they had to do when they needed that cigarette, how they could get out and get that cigarette. But now it's really they're taking that control back, as well as individuals will have more money to spend things that are important to them, or just some more fun things because they're not spending money on those packs of cigarettes. As well as individuals will have cleaner teeth and fingers, and they won't have that cigarette stench. They'll have fresher smelling breath, clothes, home, and car. As well as providing better examples to children. Studies show that children are more likely to smoke if one or both parents smoke, as well as just keeping the air cleaner for everyone else around them.
So many benefits. I love that you said about saving money. Again, a lot of people are aware of the health benefits, especially longtime smokers. I'm sure they've experienced their physicians encouraging them to smoke for a number of years. When you do the math of how much money a person can save if they quit smoking, so in the group, we distribute a chart that outlines if a person smokes half a pack a day, pack and a half, or 2 packs a day, and the money they would save after a certain length of time quitting if a pack costs $6. And from my understanding, 6 is on the very conservative side of how much a pack of cigarette costs. But some of those numbers are that, so if someone smokes a pack a day, if they quit for a week, they have $42 at the end of the week. That's a lot of money. That's half a grocery order for some people, for a small family. In a month, they would save $180. So that will pay an electric bill, a water bill, maybe a couple of utility bills. In 5 years, the person has almost $11,000. I mean, that just kind of blows my mind. The numbers are pretty shocking. And I also want to say, you mentioned some of the health benefits, not for the smoker, but for the people around them. Secondhand and thirdhand smoke are very real. 7,330 non-smokers die of lung cancer from secondhand smoke annually in the US. And also thirdhand smoke, a lot of people haven't heard of thirdhand smoke, but it's the toxins that cling to the fibers in your sweater, in your hair, in the fabric of the seats in your car or the furniture in your home. And so even if you don't smoke in your house, we find a lot of people who say, well, I don't smoke in the house. You're still bringing that third-hand smoke back in, and guaranteed, even if you don't smoke in your house, a non-smoker would probably enter and detect a smell of cigarette smoke, and that's because they can smell that third-hand smoke. We also see a lot of new moms that are trying to quit, and I give them that statistic too, because where is the baby always? On the floor, on a play mat, breathing that in from the fibers of the carpet, nestled into your shoulder, breathing that in from your shirt, from your hair. So babies are just breathing that right into their lungs, and it can be really dangerous. Secondhand and thirdhand smoke is also dangerous for pets, which can really shock some people too. Katie, why would people benefit from quitting in a group setting rather than just on their own?
I think really the huge benefits of being in a group is that you have other people around you who are coming from similar perspective, and they also are wanting to quit. So having other people who are going through the same process, although it might be slightly different, you have other people who can hold you accountable. And another really great aspect of the Freedom from Smoking program is that there's a buddy system. So throughout the program, participants exchange numbers and choose a buddy. So that way, if someone later on, when you're not in the class and you really want that cigarette, but rather than reaching for that cigarette, you call your buddy and you just talk and try to have that support, mutual support, because they know what you're going through. So really the buddy system is a great way to get that extra support, as well as holding you accountable, but also the others around you.
Yeah, thanks. As a facilitator, my favorite class is always week 4, which is quit day. So when people enter the class in the very beginning, quit day is set as the 4th class, and they're spending 3 weeks preparing for that. We bring on who we call quit champions, which are people who have quit smoking. Oftentimes they're graduates of the Freedom from Smoking program, and we have kind of a Q&A panel with them, and I always like that. Katie, do you have any feedback or things that you've seen on quit day that have been pretty powerful?
Yeah, I think my favorite part about quit day is when the participants write a letter to the cigarettes. It's basically a goodbye letter.
Mm-hmm.
And if participants do feel comfortable enough, they read their letter out loud to the rest of the class. And after reading it, they rip up the letter, throw it in the trash. And if they brought any cigarettes to that class, the cigarettes also go in the trash. So it's really a way of kind of starting new and being all together and being, okay, moving on. Goodbye, cigarettes. I said my last thing to you, and now we're moving on. As well as in this class on the 4th day, quit day, individuals sign a contract which says they will not smoke for the next 48 hours because that is when our next class comes. So after quit day, the 5th class meets 48 hours after quit day because we know the studies show that the first 48 hours can be extremely difficult.
Yeah. Where are the classes located? I know right now we're temporarily not offering them due to the COVID crisis, but where are they commonly located when we do host them?
Yeah, so there's a Freedom from Smoking classes really can be held anywhere. In the past, we've held them at host sites. We've held them at like Amos Towers. We can hold them at United Neighborhood Centers building. So really if someone wants to offer a class, we can go there, or we can have it at our own sites. So it's very flexible about where the classes are held.
Okay. We have also offered to host them at physician offices. So physicians are often encouraged to have their patients quit smoking. It promotes better health outcomes in the long run, which is mutually beneficial to provider and patient. So providers were interested in having something on site at their office, we can go there too. Katie, so NRT, which is nicotine replacement therapy, is a very commonly used intervention for people trying to quit. NRT is something like the patch, the nicotine gum. It's replacing the nicotine that's in a cigarette. So I know Area Health Education Centers is often able to provide us with some NRT. Can you speak more about that?
Yeah, so they are Area Health Education Center are able to provide the participants with the NRT. And really what happens with that is the facilitator, myself, would discuss with the participants about NRT and we try to find, within NRT, with the main 3 ones that we can provide are patch, gum, and lozenge. There are other types of nicotine replacement therapies that can be found that have to have a prescription from the doctor, but really these 3 are, I guess, the most commonly used. And within the patch, gum, and lozenge, there are different milligrams and different dosages. So within that, we talk with the participant to see how much they were smoking and trying to find that good balance of what is the correct milligram use for them.
Perfect. And we also encourage people to speak with their doctors about what's most appropriate for them. So we want to make sure that they're making an educated decision for their own health. Well, thank you so much, Katie. You gave us so much information. These groups are really powerful to watch as a facilitator, and the feedback that we've gotten from our participants and our graduates is the same, that they've really learned a lot. Relapse, I will say, is part of your quit journey. And so even if some graduates have relapsed on cigarettes later down the road, they are able to pool the tools that they've learned from the course to help them quit again. Again, unfortunately, right now we're not offering groups in the community due to the social distancing requirements, but we will be offering them again in the future. So we encourage you to still call if you are interested. We keep a list of anyone who's expressed interest, and when we have a group up and running, we'll call you and encourage you to come. You can call us at 570-346-6203. Katie's extension is 110. And we'll be in touch, and we really look forward to supporting you in your quit journey. Thank you so much, Katie, for talking to us today.
Yeah, thank you for having me. It was great.